Welcome to our educational video on botulism. Today, we'll explore what botulism is, its causes, symptoms, treatment, and preventive measures. Botulism is a rare but serious illness caused by a toxin produced by the bacterium Clostridium botulinum. This bacterium is anaerobic, meaning it thrives in low oxygen environments, which is why it can be found in improperly canned, preserved, or fermented foods. There are several forms of botulism: foodborne, infant botulism, wound botulism, and adult intestinal colonization botulism. Foodborne botulism is the most common form. It typically occurs when a person ingests foods contaminated with the botulinum toxin. Symptoms usually appear 12 to 36 hours after eating the contaminated food and can include double vision, blurred vision, drooping eyelids, slurred speech, difficulty swallowing, and muscle weakness. As the disease progresses, these symptoms can lead to paralysis. Infant botulism occurs when infants, usually under 1 year old, ingest spores of the bacteria, which then grow in their intestines and produce toxin. Honey is a known source of these spores, which is why it's recommended that infants avoid honey until their first birthday. Symptoms in infants can include constipation, weak crying, difficulty feeding, and a general lack of energy. Wound botulism is less common but occurs when the bacterial spores enter the body through a wound. This can happen with injectables or other forms of drug use. Symptoms are similar to those of foodborne botulism, but they can take longer to appear. Adult intestinal colonization botulism is particularly rare and occurs in adults with gastrointestinal conditions that allow for the growth of the bacteria in the intestines. Recognizing the symptoms of botulism is crucial for early diagnosis and treatment. Diagnosis generally involves reviewing a patient's medical history, conducting physical examinations, and in some cases, testing samples of blood or stool for the toxin. Treatment typically includes intensive medical care. For foodborne and wound botulism, the administration of an antitoxin can help block the effects of the toxin. This is critical for mitigating damage, especially in severe cases. Supportive care may also be necessary, which can include respiratory support, as the toxin can affect your ability to breathe, leading to respiratory failure in severe cases. As we've discussed, the best way to prevent botulism is through proper food handling and preservation techniques. This includes practicing safe canning methods, ensuring foods are stored properly, and avoiding giving honey to infants. If you're canning at home, be sure to use a pressure canner for low-acid foods like vegetables and meats. Additionally, always inspect canned goods for any signs of bulging or damage before consumption. Awareness and education are key to preventing this illness. If you suspect you or someone you know may have been exposed to botulinum toxin or experiencing related symptoms, it is vital to seek medical attention promptly. Prompt treatment can save lives and prevent complications. This concludes our overview of botulism. Thank you for joining us today. We hope this information helps you understand this serious condition better. Stay safe, stay informed, and don't forget to subscribe for more educational content. Together, we can promote awareness and health.